the side effects again, regarding cytokine release syndrome and neurotoxicity that people really need to recognize in the hospital is after the infusion. The infusion of the cytokine release, or the infusion can happen on day 0, and the cytokine release syndrome can occur really beginning anywhere between day 1 and day 3. The first symptom is simply a fever usually. They also have to monitor the laboratory values regarding the cytokine the CRP, which is the C-reactive protein, because that is what you can monitor to see as people are gaining an inflammatory response, that these CAR T cells have gone and latched on to the lymphoma, which is a target-specific therapy versus a cancer-specific therapy. It goes in and latches, and the T cell kills it and releases these cytokines. The cytokines can cause fevers and malaise and anorexia. So basically the first sign is usually a fever. That usually occurs between day 1 and day 5. And then when that is settling down, a lot of times that's when the neurological toxicities can happen. With regard to patients could have some word finding problems, or some somnolence, or some confusion. So part of the thing, these are the things that people need to know are the symptoms, but they also need to know how to grade these toxicities with regard to, is it a grade 1, a grade 2? The treatment plan is based on the grade of the toxicity. The nurse at the bedside especially is a person who needs to notify the provider and tell the provider that there's been a change in the behavior of the patient, either the fever or they're having some word finding problems or their writing sample is a little bit off. So it's really key that they then have a clear pathway of communication to the provider regarding who is going to intervene or whether or not there needs to be intervention at that point. Because really we need to manage it as it comes up and take care of the grade 2, grade 3 toxicities quickly to try to keep the patient safe so it doesn't get into a critical event.